and I hope you're all having a great Friday so far.
Commissioners run review. Those individuals will be held accountable.
Okay, I'm just gonna go ahead and mute. So today, if you're not familiar and this is your first time here, we host Health Council Talks on the first and third Friday of every month. The purpose of Health Council Talks is just to bring presenters, organizations, statewide partners, to share resources and to share out to health councils as a way to network, but also, again, for resource sharing. So welcome all today. And if you can please sign in, your name, if you're affiliated with a health council or your organization, just drop that in chat. And I'll go ahead and hand off if Sam or Val would like to do our land acknowledgement today.
I'm happy to, Geraldine. Well, oh, go ahead, Sam. You went unmuted first.
Okay, I figured I should talk. I haven't been here in a while. New Mexico Alliance of Health Councils humbly recognizes and acknowledges we are on unceded territory and ancestral lands of the original peoples of the New Mexico's Pueblos, Apache nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and the ongoing systemic inequities while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes, pueblos, and nations who are still here today.
Thank you, Sam. And with that, good afternoon, everybody. Valeria Larcon here, Executive Director at the New Mexico Alliance of Health Councils. And it's an honor to have Dr. Kaufman here with us today. He's the Vice President for Community Health at UNM, also obviously a distinguished professor of the Family and Community Medicine at the university, and a doctorate in internal medicine and family medicine. He's going to speak to us today about UNM's Hero Hubs. So welcome, Dr. Kaufman. So great to have you with us.
Thank you so much. I'm very honored to be invited, and we actually invited some of our health extension coordinators, and the director of the health extension program, Mario Pacheco, is also on the line. I wanted to talk about the health extension program, but also get to the point of how we would be enhanced by collaborating with health councils in the service of improving health and social well-being in all of our counties and tribal communities. What I'd like to first start out was how we envision this problem is so important facing us now around social determinants. And then I'll explain basically what health extension coordinators or heroes do, and how our heroes and community health workers work together, because both of those programs are in our Office for Community Health, and why they're very complementary to each other. And the concept of setting up a hero hub in each county where we would have community health workers, health extension agents working with community partners like the health councils. And then what are the funding opportunities that both of us can share as we look ahead, and possible collaboration. Next. This is a data fragment which just tells a whole story. And basically, if you look at the quality of care around diabetes in New Mexico, the group, or one of the groups that has the best screening and treatment for diabetes is the Native American group. And there some of the innovations in that screening and treatment are really far in advance of many other communities. And yet, that community has the highest death rate from diabetes. So despite the fact that there's great screening and treatment and programs, it can't make up for the decades of adverse social determinants, whether that's low income, housing, nutrition, social marginalization, racism. All of that has a huge impact on health, which if we're only working with people after they've gotten a particular disease or gotten worse from it, it's way too late if we're talking about preventing that from happening. Next slide. Next. So if you look at all the states in the United States, the Institute for Public Health did a study, and what they found is that New Mexico has the highest burden of adverse social determinants, food, housing, nutrition, transportation, all of those factors. And for that reason, the burden is so high that it's very hard for us to treat individuals, have a good outcome for communities in terms of their health without addressing social determinants. And why is it that we spend so little on social determinants? Next. So this is a really important slide. If you look at the left of this column, what you see is that health services that consume over 90% of the US healthcare dollar only affects about 10 to 20% at most of health, mortality, morbidity. 90% of the dollars, 10 to 20% of the health outcomes. But if you look at lifestyle and environment on the left, that's over 60% of what causes or what helps there to be health, prevents morbidity and mortality. That's where social determinants are found. And if you look at the right side, it's only 3% of the US healthcare budget. So we're wildly discrepant. Where we put our money is not preventing a lot of the illness and disparities we see in our communities. So what is the way that we can somehow reallocate this huge resource towards upstream social determinants? And that's really our task. Next. So what we did some years ago is we said, well, what is the prevalence of these adverse social determinants in our own population of all of our UNM patients and primary care, all of the first choice patients in our Bernalillo County or Tri-County area. And so we tested about 50,000 patients with these questions: food, housing, utilities. In other words, what is the prevalence of this? Well, we just ask all of our patients. And the data is on the first 3,000 patients, which is exactly the same as the rest of the 50,000 patients. Next. And what it showed was 48% of our patients have at least one adverse social determinants. Half of those have more than one, some 5 or 6. But what's important is it is not known to the clinics because we don't routinely ask these questions. Next. So there was a study done by the Robert Wood Johnson Foundation of thousands of providers, doctors, others. And what they found was that 80% of the providers said that, these social needs are as important as the traditional medical needs. And if you don't address those social needs, you really can't make much progress in health, but that the systems they work in don't allow them to address those needs. And by the way, it's not just for poor people, it's across the board. Next. An example of the link between a social need and a health outcome is this. If you had every single high school student graduate across the United States, you would save as many lives as every smoker stopped smoking. You can do this with every single social determinant. This is so clear, and there's many, many reasons for this. So the studies have been done. The question is, what are we going to do about it? Next. So one thing we found is we wanted to share this information across the board, starting with our Health Science Center and then our university. So we developed a certificate for social determinants of health, and we're now rolling this out. It's absolutely free. It's online. Everyone here can have it for free. You can get CEUs, CMEs. At the university, we are putting it on Learning Central, so everyone has access to it, because we want people to understand the importance of this. And it doesn't matter what health field you're in. It doesn't even matter what field you are in general, because this was put together not just by the Health Science Center, but also looking at all the components of a university: architecture and planning, engineering, law, education. All of it has relevance to social determinants. And we wanted to demonstrate that as we were all learning. And it's not just to know stuff about social determinants. It has, at each step, how do you apply this information in your workaday world or in your student world? Next. This is just a very simple category of the kinds of things that health extension does. Health extension came out of our admiration of agricultural cooperative extension. And we're very impressed with the fact that every single county in the United States, urban or rural, has agricultural agents, but they're tied to the land-grant universities. In New Mexico, that's New Mexico State. We're a flagship university. Oh, we don't do that. Oh, no. If they are so successful, how come they're in every county and we're not? So we said, let's model ourselves, learn from cooperative extension, and apply it to health so that we could be in every county, also bringing the resources of the university, if needed, to the needs of that county. So we would engage in local partners. We have a set of activities, including technical assistance, training, facilitation, policy development, and then we would have a set of outcomes. The outcomes totally driven by the community. What does the community say their priorities are? We're very impressed because much of that data is collected and reported by the health councils. So what we bring would be resources to try to address those council and community-derived priorities. Next. This is what it would look like. And we have those little dots are where we currently have health extension agents, either full-time or part-time. And what we also realize is we have these two strengths. The community health workers are very skillful in navigating patients or individuals and families to needed resources in the social determinant sphere. What heroes do is they try to set up programs to address social determinants, programs that don't exist. So that is one of their major tasks in their local community, driven by community need. So you have these two complementary groups, individuals who work together at the community level. And this can be applied in tribal communities at their interest or their request, as well as in counties. Next. This is a busy slide, but if you just look at the lower right, the purpose of this colorful grapes is that for health extension to be effective, they're only as effective as their relationships with all of the other stakeholders in any community. So the right, you can hardly read this. On the right, they're just different kinds of stakeholders. That's all this slide means. That's why this discussion is very important for us, because we're talking to one of the most important partners that we would have in any community. Next. And this just summarizes that collaboration that I talked about. But you're also able, these units, to tap into resources across the campus, and it can be in any mission area. It may be in writing a grant, or it could be in calling for clinical services, research areas, policy. All of it is fair game, depending if that's what the community is interested in. But many communities simply don't know what a university has, because we're so siloed and so complicated. But if you look at the little circle on the left, that's kind of the basic model of these hubs, health extension hubs in a community. They'll always have a health extension agent. They'll always have a community health worker. We always want to have learners so that we're always developing a pipeline in any community, any role that we could play in connecting them with higher education or just graduating from high school. That's also fair game. And then always some connection, usually telehealth, back to what other resources may be available. And we're not exclusive just to the university. That's our special relationship, but we'll link with other higher education. We have a lot of work with agencies, whether they're Medicaid or Department of Health or Aging and Long-Term Services. We work with them all, and we can mobilize those resources as they mobilize ours. Next. This is just an example of that same model with all of the potential social determinants of health kind of as a necklace around this core. And this was of great interest to aging and long-term services, so that we're working in 4 counties, Bernalillo, McKinley, Valencia, and Lee. And in those counties, I think we already work with health councils locally. Next. This just says that one of the most important contributions this model makes is to getting kids to stay in school, graduate, enter any health career. Very important because we're a huge and rapidly growing sector of the community. I think we're up to almost 20% of the gross domestic product. We never have enough of any health worker. So this is a great area for young people to get into because they'll have careers. Next. This is important to understand why we must look at changing the nature of who comes into the health careers. As it turns out, if you look at the data, let's say you're an African American or Hispanic, it's exactly the same thing if you're a Native American or Asian physician. Your likelihood of seeing patients of that ethnicity is 5 times as high, 5 times, as if you're an Anglo physician. Lots of reasons for that, but this is an access issue. In a country that within 30 years, the majority of the population is going to be, quote, ethnic minority, rapidly moving. The health system is not producing graduates that reflect that population shift. So we must reach out into our communities and inspire young people as much as we can to come into health careers at any level. Any one of them is all good. Because our patients need it, because it's not only access to care. As it turns out, if your, let's say, physician is of the same ethnicity, your outcome is better. This was in the last few years. How did that happen? So it's better for access and it's better for health outcomes. We must change the nature and the mix of our health profession. And so for that reason, part of this model is to inspire young people to get involved with us into health careers. We are not the only ones doing this, but that is one of the components. Next. These are just some examples of what health extension does. Helen So is our up in San Juan County, working in Shiprock, and one of the big needs was huge food desert areas. And she was able, with others, to mobilize donors who were very interested in this issue of nutrition in Native American communities. So she worked with others locally to set up a food hub, and that's sustainable. That's going on and on. And this is kind of grown with other heroes down in McKinley County. Just an example, that's the social determinant priority. That's what she worked in. We got resources to support that ongoing. Next. This is unusual for us. We were approached by folks from Silver City who were spending all day on a Veterans Administration bus. They're all veterans, to get like a milk run to get to Albuquerque to go to the VA hospital. And then they had to sit around all day until the last person was seen, and then retrace their steps all the way back in the milk run. So it was like he came back at home at night to have his clinic visit, which he had to especially visit in the Albuquerque VA. And it raised the question, isn't there a better way to have public transportation in rural New Mexico? It's a big need. We're not an expert in this, but we link with the university. So we started to work with civil engineering. They have all these experts, which I didn't know, in transportation. And they started to develop models, which we tapped it. We haven't gotten this funded yet, but we're working on this to try to figure out how to mobilize the university resource in one of these big social determinant needs for the major need for public transportation in rural New Mexico. Next. The epidemic of loneliness in our society, especially among elders and especially in rural areas, is palpable. And we were asked by Aging and Long-Term Services 7 years ago if we could help them. There were 18,000 elders who had called to see if they could get resources for which they were eligible. They never got a call back because they were overwhelmed. The Aging and Long-Term Services didn't have enough people to call them. So our College of Nursing Medicine set up a call center next. And they went ahead and they called over 10,000 elders all around the state, and they got them these resources. The leaders trained students how to do the calls, train them on what the resources were and how they can help them access. It was incredible. So we use that for getting people COVID shots. Now we're talking about how to help people get discharged from hospitals, to follow up to make sure their social determinant needs were met. So that's another example of how we could tap into the resources of the university. And this was for free. Next. Another big issue is the low income of people in New Mexico. And as it turns out, one of the largest national poverty reduction programs is earned income tax credit and child tax credits. And the law school developed a model where they could train their law students, clinical law students, in how to screen individuals of low-income families for access to earned income tax credits, and then get them those resources. And it's a very fast screen. You have to have a social security number. You have to have worked at least 1 hour in the previous year. You don't ever have to have paid taxes. Usually, if you have very low income, you don't pay taxes, but you'd still be eligible. The average income of clients that they work with is about $10,000, but they on the average got them about $2,500. So that's like a 25% jump in income for families with very low income. So we got a grant. We trained a large number of community health workers. Next. And within a year, they were able to generate, what it was, a massive amount of money. How much was that? Oh, here we go. Yeah, almost $650,000 that they were able to put into the pockets of low-income families with a combination of both earned income tax credits and child tax credits, a little bit higher than that. So what they found out, however, and this you could help us with, is that in order to do this, you need to have a volunteer income tax assistance office or access in your community. Well, we have this in Bernalillo County, but it's not in most rural counties. So we have 2 of our employees working on seeing how to set these up in rural New Mexico, so everyone gets access to this basic need, a social determinant resource. Next. This just summarizes what it means when you can mobilize the resources of not just the Health Science Center, but the whole university to look at these different social determinants: housing, food, transportation, income, education, and more. And this is our task. It's not that easy because, as I mentioned, universities are very siloed, but now they're beginning to come together because each of them realizes they have a critical role to play in the health and social needs of their communities. Next. So this is kind of worked with Valeria and the other leadership of the council. And we thought that there were so many ways of partnering. We could have kind of a formalization of MOU. We could serve, if we could get what those needs are, we could start to work on those priorities with the council. We can also set up conference with all of you, and then also collaborate, and we can have breakout rooms on a Zoom with the Heroes Health Extension and community health workers in the different areas of the state to start to strengthen that relationship. We already have examples of this. Tana Beverwick in Rio Arriba County is the head of the Health Council. She's one of our partner heroes. She does everything. She runs a nonprofit. I mean, that's a model we have that we could build on. We have a lot of connections in our different counties, whether it's in our aging programs and others. So we know it works. We just have to put the effort in to start building that relationship. Next. And then finally, what are the funding opportunities? So we have resources from, and it's not a grant, it is ongoing. It could theoretically be forever. It's the federal government looked at our programs, essentially liked them, and we were able to work with our hospital and with state Medicaid to put together a program where we would have these health hubs in every county and in an interested tribal communities. And that would give an interested person in the community who already does this kind of work. We're not inventing how to work with communities. The leaders are already there. But if there's a leader that usually works with a nonprofit that's interested in this work, we could give an extra resource to make that relationship with the university and do this kind of extension work locally in the county. And they would also pay for each county, would get a $70,000 to hire a community health worker or a community health representative. And they could do the work with it. And it doesn't have to be other work. It could be work around everything we're talking about. The reality is we do a lot of fundraising. And the amount we put in per county, usually we get much more than we putting into that unit through contracts, grants, donations, and large donations. We have a whole UNM foundation that has been able to really expand some of this work. So working with the university and communities together, we're able to generate many more resources for them. Valeria asked one time, what about, could a council be a hero? So we said, why not? I mean, we're flexible. One donor said, hey, do you have any librarian heroes? Okay. And by golly, the Mescalero Apache hero is a librarian in Mescalero Apache. So we're open. We could do that. We would like to hear what a proposal might be. And we understand that many are, if not most, are nonprofits which fit in to how one would receive and use this resource. So our bottom line is we would like to partner with the councils, and we could do this in a variety of ways, all up for discussion. But that's all I have. Next, I think that's the end.
That's the end of the slides.
Good. Yeah, so any questions? And we have a bunch of folks on the line who can also answer any question.
Dr. Kaufman, if you don't mind, we're just going to open a poll just for one question, just to gauge what health councils know about Hero Hubs. And if so, the question is, how many health councils or partners on this call have collaborated with their local UNM Hero Hubs?
Oh, wow.
Oh, I have not, or maybe this is the first time you're learning about Hero Hubs today. So we'll leave this question just open a bit. Okay.
You're
Awesome.
very high tech.
Yeah, we've got about 50% who submitted. So if you see a question on your screen, feel free to answer. And we'll close at about, what do you say, Sam? Maybe in about 20 seconds.
Yeah, 20 seconds.
Okay. All right. Up to 60% participated. So we'll just go ahead and share out the responses now. So you can see here on your screen, we've got we had 16 who responded. 3 of the 16 have collaborated with the Hero Hub. 4 have not, and 9 of the respondents, this is the first time learning about Hero Hubs today. So let's open the floor for questions, especially for those who are their first time learning about Hero Hub today and what this partnership could look like for health councils.
My name is Joyce Nasiyama Chalan, and I wanted to just ask Dr. Kaufman. I don't have a question. I just wanted him to also clarify that not all of us are Hero Hubs. We're Hero Partners. So maybe a little bit more explanation about that, because I, as a representative for the Sandoval Regional Medical Center, it's the partner. And so we don't necessarily, so our work may not be in the realm of a hub, but more so on a partnership. So I just wanted that to be clarified.
Yes, thank you, Joyce. So usually there's two kinds of heroes. One is a full-time, that's what they do. And they usually work in a region. So they're not linked to just to a county, a region. Partner heroes, that's the one we paid like 25,000. We will be paying 25,000 for. That is someone who does the kind of work that's so related to social determinants, like Joyce Nacion, who just spoke, or Carla Saquedestoa, who's on the Zoom as well. So they do this kind of work, and this gives them an enhanced resource that they can have freeing up part of their time, or they can use it for the kind of work that is of value. Virtually all the hubs that we're talking about will have partner heroes like Carla, like Joyce, and like others probably in the poll, as opposed to a regional hero that they'll kind of relate to, not that they're supervising it as much relate to, so there's some coordination. And when we see patterns of like a group, like Let's Food is a perfect example, that was done more as a group, so that other resources came in for food in that set of 2 to 3 counties.
So I would just say Mario Pacheco, I'm the Associate Vice President for Community Health and a family physician in Milwaukee. Just to clarify also, as we grow this whole program, it will be largely partner heroes in each county with the community health workers. So that's what we're calling somewhat of a mini hub. It would be the partner hero with the community health workers. Then we have the bigger hubs that are regional or population based.
And Dr. Kaufman, I know there were a few attendees who requested the link to the SDOH certificate, but seems they are having issues, like a barrier issue once you've done the registration.
Okay, so let me do this. We could have Faye Torres, who developed and runs, this is for the certificate?
Yes.
Yeah, so let me have her connect with you so that it's easy access to everybody for this. It varies. We have noticed some difficulty in access, but we want to overcome that. If she knows what the barrier is, so she connect with you?
Yes, that works. Sam and I,
Okay.
we can share the link out to health councils.
Okay. We'll do that.
Okay, and question from Carla?
Hi, not necessarily a question, but I am a Hero Partner. I'm the Native American Hero Partner at UNM. So in my role, I live and work and thrive on the university, on the UNM campus. And I work directly with Native American faculty, staff, and students, trying to bring together all the different silos just within the campus. But all the hero partners are actually have full-time jobs, and they do this on top of the work they do because they have a strong belief in their in helping their communities. We have Danielle here, who is also she is a hero partner, and she works with a lot of school justice systems issues in her community. So it's whatever the needs are in the community. But as a UNM hero, I'm able to actually try to bring in resources and work with other people to work with that will enhance the hero hubs. And especially where it concerns tribal groups, because since I'm Native American, my passion is to help the people. And so with all the social determinants health, and Art mentioned about education, high school graduation, I'm being part of the educational administrative system here on campus. I'm always trying to see about how we can enhance outreach, educational systems to our tribal communities, and also educating our people on what, not our people, but mostly how we can utilize the resources at UNM to benefit our tribal people and assist them with our own social determinants of health, because tribal social determinants of health is a bit different from the main population of New Mexico. We're all different, as that's what makes our state beautiful, but everybody's situation is different, and that's the benefit of being a hero partner.
Rio.
Thank you. So I just wanted to make a note. Siri just asked about if contact information could be presented and get a direct email. And I think Kelly, who is the manager of the HERO program at UNM, I think has also expressed interest in having that kind of a connection to be able to communicate with you all. So I don't know, Kelly, if what the best way for us to do that, to increase that that communication. I assume this is to get the social determinants of health certificate information. Is that correct, Siri?
Yes, I'm very much interested because I include this information in some of the courses I teach.
And the Alliance is able, because we do weekly announcements, we'll send out to all health councils and statewide partners. But if you want your email, yeah, just drop it in the chat. I think that's what Kelly was getting at. And we could definitely, I think on Kelly's end, she can arrange that. Oh, Dr. Kaufman, there's a question from Brenda, one of our health councils here. What is a time commitment to be a hero partner?
The contracts, Kelly, it's usually a year at a time, but we're flexible. The contract is just renewed every year. There's no, demand you have to do this for 5 years. We wanted to meet your needs, and people they can change. If you're looking at, I don't know, Danielle Vanderpool is on, just to give an example, she's up in Colfax County in Raton. Danielle, can you just give a quick kind of example of what you do, but also this issue of how long is the contract and how that works? How does it work in your situation? And you're in a nonprofit, and therefore the easiest person is to pay the nonprofit, who then hires or has that employee as part of the nonprofit. Danielle?
Thank you, Dr. Kaufman. Hello, everyone. I am Danielle Vanderpool, and I am the COFAX Partner Hero. And I currently work with the 501c3 Regional Agency Intervention Network, which is a fiscal agent of the HERO contract. And working with RAIN, they also have a committee with a president who is responsible for MCMC Hospital here in Raton, New Mexico. And she is the chair of our board. And then we also have professionals from all different faiths and different organizations. And we all support each other and come together once a month to talk about the health and social determinants within our community. We get referrals from our schools to be able to provide restorative programming and restorative support to our students that might be experiencing some conflict. And over the last 3 years, we have been contracted now through the UNM COVAX Partner Hero. And before RAIN, the Center for Community Innovation was a 501c3 with the contract, and they did a wonderful job in supporting. During their duration of time of having the contract in 2 years, they developed a HiSET program to help students because one of the social health determinants in our community is many students ages 18 and up did not have their GED or high school diploma. And so they worked with Luna Community College, brought in this really great HiSET program with support with a HiSET facilitator to provide ongoing support. And additional to that, a total of 22 jobs were provided that year in prevention and intervention for our youth at risk. That was a great pleasure. Now, moving forward real fast, we are working with juvenile community corrections and engaging youth that are at risk, but also involved with law enforcement JPO referral. It is a court-ordered referral that bring them into the program. And they are receiving life skills, restorative programming support, conflict resolution, and also goal setting and workforce initiatives and support for family to provide ongoing support and to navigate the resources that they need through case management. So we're very fortunate here in COVAX Partner Hero to work with the University of New Mexico, and we just felt honored to be a part of this. And again, we will be starting up our next planning committee to move forward with our strategic planning for this fiscal year of 2025. Thank you.
And so I believe it was Brenda, the time commitment varies depending on priorities. Is that correct? And the role of each partner?
Yes, yeah, and again, the hero doesn't have to do everything. A lot of it is connecting with other resources, guiding us, just as we try to work with others at the university to get your needs met. And sometimes we succeed, sometimes we don't. But it's the kind of request for information actually led us to develop the certificate. And the certificate, you can get the whole certificate, or you could take parts of it. We're flexible. And at the same time, each partner hero has a very different set of interests, and it can change over time. So yeah, I just like to show how flexible this is. The outcome is the needs and health of your community. We don't count hours.
So I just wanted to reinforce here. So some of you may be interested in being partner heroes, but I think one of the key roles that we would like to partner with the Alliance with is identifying partner organizations and people who may be interested in being the partner heroes and community health workers. So I think you know your counties. We don't. And so that kind of link would be really, really important because it may or may not work for the county health council to actually be the hero in each situation. It might work in some, but that link with identifying those community organizations and individuals who could be the partner hero would be an incredible step forward for us implementing this new resource that we have.
Thanks, Mario. And Joyce?
Oh, I just wanted to add that Sandoval Regional Medical Center has been a partner hero for, I think, 3 years. And my work is primarily on the, access to care portions. But what the hospitals are, the university hospitals now are doing as part of their care is doing the social determinants for health assessment. And so we were looking for ways to begin to create the linkages from our medical institutions to the communities as these needs are being identified, because it's just a fact that hospitals probably are not at all familiar with what are the resources in the communities. So that's partly why I think your partnership and our relationship, and if anything, is so critical. So just getting the word out about this opportunity, but also looking for interested partners. And I don't, and it's not about counting the hours. I think it's just, again, a method to create linkages and know that resources, not only to support you all in terms of business and stuff, but also resources in the community. We just need to have that link. So it's a very innovative initiative, because the university hasn't necessarily done this very well. And so now that's why we're primarily like, we're pushing it, and just appreciative that this model has finally been thoroughly understood and now being accepted as a very good practice for community engagement. So that's basically where we're at. And so, as an example, my work is I do a lot of care coordination with our tribal communities. So I am connected to clinics, local clinics, and then the community health worker. We call ours community health representatives. And we basically are supporting each other in terms of patient care and follow-up. So I think I'm probably the only one that has that role in all of our hero partners. So it just varies. It's an interesting group in terms of what we do, just as Danelle was describing her role in the schools. And Lillian down in Mescalero, her role in the community as a librarian. So it's just a very interesting and very diverse group. I just wanted to add that.
I'll add also, Valeria asked, so we work with different programs across campus. We sit under the executive vice president for health sciences. So we're one of the vice president groups. So we work with everybody. And Valeria asked, hey, do we work with Project Echo? Because they're also have telecommunications around the state, telehealth. And yes, we do. As a matter of fact, and this, I was thinking about this before this presentation. They wanted to put together, as part of their diabetes program, that was another interest, they don't have many connections in the southern 8 counties in the state. And they wanted to know, could we develop a social determinant training for health providers, hospitals, and others in that area that we could give for them as part of their diabetes program. Well, as it turns out, that's also where we're developing new hero hubs in all of those counties. So it's a perfect example of how we can develop the hub. It becomes an access point for another program, in this case, Project Echo, and it serves our purpose of linking other university resources to those priority needs.
This is Carolyn Morris. I just joined the program, and I think I really like the discussion on social determinants of health. And I like to hear more about your program. So hopefully you have some information on that. And in tribal communities, social determinants of health can look very different than other communities. So like, for example, wood. In the wood and coal, a lot of times people within our communities, they use wood, and they don't use propane. They may use butane bottles to warm their house, or coal. So those are some things that if UNM had a forestry program, maybe there could be some ways to think about getting wood, free wood for people that really need wood. But I know that the managed care companies, they have like a wood project that they cut wood and then they have people come and get their free wood. But it's there's different ways to address social determinants of health. And I like to connect with your program. And I know we work with UNM a lot on Project Echo and various other programs, and they have been very helpful. And I just like to say thank you, UNM, for making sure that we ask for something, we may not get it, but again, we keep asking for our community members. So that's a way we have to have partnership and collaboration and really understand what is different in metropolis area, metropolitan, rural, frontier, and tribal communities. So you can help us get the needs that we need for our community members. So I appreciate that. But I'll read more about your project that you're just, the model that you're describing. Thank you.
Thank you.
And Dr. Morris, we could share the recording and some slides with you sometimes next week. So I'll follow up.
Okay, great. Thank you so much.
And Dr. Kaufman, I know I did ask in chat if you could share a list of all Hero Hubs with contact information in case health councils would like to reach out to partner or to invite Hero Hub representatives maybe to their health council meetings just to start establishing those relationships.
That would be great. Kelly, she coordinates everything, so she'll get you that whole list. And remember, something that Mario Pacheco said is so important is that now with another resource, we can increase the number of counties in which we have Hero Hubs. And we would look to the expertise of the county health councils to help us identify people who may be interested, that we could interview for these two roles, one of them being a partner hero, the other being a community health worker or community health representative. So that would be an immediate need we have where we can connect. But for the ones that exist now, they're all over the state, but they don't cover every county. But we will be growing to every county. Kelly Camden will send you that information.
We can certainly invite you to our health council. But I think that who do we let know that we're having a health council meeting? If you want to come and present, certainly you're more than welcome. We'll put you on the agenda and you can give us the information. And then that's how we like to work with our partners and collaborators. That way we know you're out there. So we can begin to make that connection and make it work for the community.
That's great. And then Carolyn, which community are you in?
I'm from Tohajile. I'm with
Tohajile,
the Tohajile. I'm not from the community, but I work in behavioral health there.
Oh, okay.
Yes.
Good. And so that if we could kind of centralize those requests through Kelly Camden's office, then we can make sure people come and respond to those requests. That would be great.
Lydia?
Hi, I just want to add on what's already been said. In my case, I'm a full-time hero, and I am actually in the international district. I actually work mainly with the immigrant community, and definitely focusing on social determinants of health, as all of the heroes are. And right now, one of our focus areas is health for the immigrant community. Some of you may be aware of the One Hope Centro de Vida Health Center that has been in existence for over 16 years. and I used to run that clinic as in a nonprofit, but it was about to go away, or it was going to be shut down back in December. And we were able to save it, and now it's going to be under the UNM hospital, and it's going to be under our office. And so I'm going to be running that clinic. So basically what I'm saying with this is that we are focusing on whichever needs the needs of the community are, and in this case, health. And in my case, I am a community health worker and a hero. So we actually talk about how do we combine the two? How do we link those two? I actually do both, as many as other heroes do. There's some who are community health workers and heroes. There's others who are not. So it's based on each community and their needs. But one of the things that I want to mention in terms of the way we work and how we actually intersect and we combine as possible the two, or how to combine the two. There's a definitely important win that we had with the UNMH hospital. For over 20 years, I actually worked in other areas, and that's how, and it's important to talk about this because as we come in as heroes, it's not that we come in and we start from scratch. We sometimes carry our work with what we have been doing in the past. For over 20 years, I was working, or for over 20 years, I've been working on how to get access to the immigrant community, and talking specifically about the UNM Care program that the hospital has, the financial assistance for the Bernalillo County residents. And for the longest time, the undocumented immigrant community couldn't have access to it because of the law, because of policies. And so working with working with different nonprofits, working with many different partners, we actually carried the work, and then it was accepted so that everybody was able to have access. And then there was some clauses that actually prevented the for that to happen. So then we had to go to the legislature and do it. So I started that work as a community health worker, and then carried it through as a hero. And so working with the community individually, but also policy changes. So at this point, I can say after 20 years or over 20 years, we were able to get that passed. And now we can say that anybody within the Bernalillo County can have access to UNM care. That's definitely a win-win for the county residents. And it happened through the work that I actually carried through as a CHW, but then as a hero, and continued the work as a community health worker. Those are some of the things that we can definitely partner and find the needs, and find link and connect with partners and different stakeholders who want to partner and continue the work.
Thank you, Lydia. That's a great example, and to see it from, I like how you mentioned you're not starting from scratch, but to build on community needs and, prior initiatives. And so, no, I definitely see, I think we all see the alignment here of the work happening between heroes and health councils. And Kelly, if you're still on, I think another good recommendation, if not all health councils were here, it would be great if you could reach out individually to each health council, or if there's any way the Alliance can support that coordination for those who weren't able to join today, to possibly get on the agendas of health councils to talk about the funding opportunity in detail and answer any questions, because all of our councils are structured differently. And I know we're at the top of the hour, it's 1. So just wanted to say thank you to Dr. Kaufman and the UNM Health Sciences Center. We always enjoy working with you, and looking forward to supporting this initiative even further. So yes,
Thank
any
you,
closing
Joe.
remarks? All right. Well, I hope you all have a great weekend. We will send out all the materials and links from today's Health Council Talk session. So have a great weekend.
Thank you very much.